When you select a handful of nuts, you are likely under the impression that you're making a wise and healthy decision, particularly for seniors who are focused on maintaining an active, independent, and vibrant lifestyle. Nuts are frequently celebrated as snacks that are dense with nutrients. While this holds true for many varieties, it's important to understand that not all nuts are created equal. Certain nuts can silently introduce health risks, such as potential liver strain, fluctuations in blood sugar, or even negative interactions with medications you might be taking. Conversely, other nuts act like nutritional powerhouses, helping to protect your heart, fortify your bones, and keep your mind sharp as you advance in years. In this video, Dr. William, will guide you through a straightforward, easy-to-follow plan for selecting the nuts that benefit your body and limiting those that might work against your health. This is not about cutting nuts out of your diet entirely. It's about gaining a clear understanding of which ones actively contribute to your health goals and which ones could be subtly undermining them. By the time we're finished, you will understand precisely which nuts belong in your pantry, the best ways to enjoy them safely, and the reasons these choices are so critical for your long-term wellness. Let's explore how these small snacks can create a significant positive impact for older adults aiming to flourish in their later years. For many, nuts are a preferred snack because they are correctly perceived as a wholesome substitute for processed options like potato chips or cookies, and that initial feeling is absolutely correct. They are loaded with essential nutrients such as healthy fats, protein, and various minerals, which makes them both a convenient and gratifying choice. Yet, for older adults, the implications of food choices are more significant. As we get older, our bodies metabolize nutrients in different ways, and health issues such as hypertension, diabetes, or diminished bone density become more prevalent. Choosing the wrong type of nut can worsen inflammation, create instability in blood sugar levels, or conflict with medications, complicating the management of your health. On the other hand, the right nuts provide compounds that combat the aging process, shield your brain from cognitive decline, and maintain the strength of your heart and arteries. A 20-year study featured in a prominent cardiology journal showed that one widely consumed nut could elevate the risk of liver damage by nearly 48%, while others can markedly decrease your risk of heart disease and mental deterioration. This guide from Health and Food with Dr. William will detail which nuts to embrace and which to be cautious about, enabling you to make knowledgeable choices that bolster your health each and every day. Let's begin with almonds, a true nutritional champion for older adults. These nuts represent a fantastic option as they are brimming with nutrients that directly address some of the most significant health concerns for seniors. A single 1-ounce serving, which is about a small handful, delivers approximately 97 milligrams of calcium, an amount comparable to what you'd find in a quarter cup of milk. This is vital for preserving bone density and helping to prevent osteoporosis, a condition that poses a greater risk as we age. Having strong bones is fundamental to remaining active and independent, whether your passion is gardening, taking daily walks, or playing with your grandchildren. What sets almonds apart even more is their magnesium content, which works synergistically with calcium to help it get absorbed into your bones instead of accumulating in your arteries or soft tissues, a process that can elevate cardiovascular risks. This partnership between calcium and magnesium acts as a natural safeguard for your skeletal system, keeping your bones robust without jeopardizing your heart health. Beyond bone support, almonds are rich in antioxidants, especially within their skins, where flavonoids and vitamin E combine to form a potent defense against oxidative stress. Oxidative stress is the biological process where damaging molecules harm cells, accelerating aging, contributing to memory issues, and weakening the immune system. By combating this process, almonds assist in protecting your cells, promoting healthy skin, and may even help in preserving memory function, which is essential for seniors wishing to remain mentally acute. The vitamin E found in almonds is also instrumental for skin vitality, aiding you in sustaining a youthful appearance and resilience to environmental factors. For your cardiovascular system, almonds provide about 9 grams of monounsaturated fats per ounce, the very same heart-healthy fat fats found in olive oil. These fats work to lower LDL, bad cholesterol, while raising HDL, good cholesterol, thus keeping your arteries supple and supporting overall cardiac function. Furthermore, with 3.5 grams of dietary fiber in each serving, almonds aid in digestive regularity and contribute further to managing cholesterol levels, positioning them as a daily essential for seniors who aim to feel their absolute best. Next on our list are walnuts, frequently referred to as the brain-boosting nut, and their advantages are truly remarkable. Their distinctive brain-shaped look is almost a visual cue to their primary benefit, supporting cognitive health as we get older. Just a single ounce of walnuts delivers around 2.5 grams of alpha-linolenic acid, ALA, a plant-based omega-3 fatty acid crucial for preserving the structure and fluidity of brain cell membranes. This allows neurons to communicate more efficiently, a function that is critical for seniors wanting to sustain mental clarity and rapid thought processes. Studies from a leading university have demonstrated that the omega-3s in walnuts can enhance cognitive flexibility and processing speed in older adults, helping you stay sharp for everyday activities like managing your finances or enjoying your hobbies. This is particularly vital because age-related cognitive decline can begin subtly but can significantly affect one's quality of life over the years. Walnuts also house polyphenols and vitamin E, two powerful antioxidants capable of crossing the blood-brain barrier, which is a selective filter that regulates which substances can access the brain. This unique ability enables them to directly combat inflammation within neural tissue, a key factor in conditions like Alzheimer's disease and other types of cognitive impairment. Persistent, low-level inflammation in the brain can slowly erode memory and thinking abilities, but walnuts help to counteract this, serving as a natural defense for your mind. Another special advantage of walnuts is that they contain a small quantity of melatonin, the hormone that governs our sleep-wake cycles. A great number of seniors face challenges with interrupted sleep, which can negatively impact mood, energy levels, and mental acuity. By making walnuts a part of your diet, you might see an improvement in your sleep quality, which consequently supports your overall sense of well-being. Whether you are solving puzzles, sharing memories with loved ones, or just enjoying a peaceful night's sleep, walnuts are an easy and tasty method to safeguard your brain as you age. Now, we'll discuss pistachios, a compact yet potent nut that is a true champion for cardiovascular health. With approximately 160 calories per ounce, pistachios are a lighter choice when compared to some other nuts, yet they deliver a significant nutritional impact with a well-rounded combination of plant-based protein, healthy fats, and antioxidants. What makes them particularly beneficial for seniors is their substantial potassium content, offering around 285 milligrams per serving. Potassium plays a crucial role in counterbalancing the blood pressure elevating effects of sodium, which is essential for older adults who are managing hypertension, a widespread condition in this age group. Scientific trials featured in a well-regarded nutrition journal have confirmed that regular consumption of pistachios can result in significant decreases in systolic blood pressure, assisting you in maintaining your heart's optimal condition. This is especially important for seniors who wish to remain active and prevent serious complications such as heart attacks or strokes. Pistachios also excel in the area of blood sugar management, which makes them a shrewd selection for the many seniors dealing with type 2 diabetes or insulin resistance. Their low glycemic index ensures they do not lead to sharp increases in blood sugar levels. Additionally, their combination of protein, fiber, and healthy fats slows down the absorption of carbohydrates when they are consumed as part of a meal. This helps to avoid the post-meal blood sugar surges that can make you feel tired or elevate diabetes-related risks. Beyond their benefits for the heart and blood sugar, pistachios also contribute to vision and brain health due to their high concentration of lutein and zeaxanthin. These two carotenoids work to protect the macula, the area of the eye responsible for clear, sharp vision. These compounds may lower the risk of developing age-related macular degeneration, a primary cause of vision loss among older adults. Recent research also indicates that lutein and zeaxanthin may be involved in preserving mental sharpness, helping you stay focused and attentive. Pistachios are a versatile, heart-smart snack that can make a substantial difference in your daily health regimen. The fourth nut to incorporate into your diet is the Brazil nut, which provides very unique advantages but also comes with a vital warning. These nuts are an unparalleled source of selenium, a trace mineral that is essential for thyroid function, immune system health, and cognitive protection. A single large Brazil nut can contain about 96 micrograms of selenium, an amount that exceeds the daily recommended intake for most seniors. This characteristic makes Brazil nuts less of a casual snack and more akin to a natural supplement encased in a shell. Selenium is critical for the conversion of the thyroid hormone T4 into its active form, T3, which is responsible for regulating metabolism, energy production, and mood. This is particularly crucial for seniors, especially postmenopausal women, who are more susceptible to thyroid problems that can lead to fatigue, weight gain, or mental fog. By promoting thyroid health, Brazil nuts can help you feel more energetic and emotionally balanced. Selenium also works to protect neurons from the damage of oxidative stress, which has been associated with cognitive decline. Studies indicate that low levels of selenium are linked to poorer memory and thinking abilities in older adults, whereas enhancing selenium levels can support clearer thought processes and better mood stability. The benefits of Brazil nuts also apply to the immune system, helping your body defend against infections and maintain its resilience. However, their extraordinarily high selenium content means you must adhere to strict portion control. Consuming more than one Brazil nut per day, or two at the absolute most, can lead to selenium toxicity, which can manifest with symptoms like fatigue, digestive upset, brittle nails, hair loss, or even nerve dysfunction. To remain safe, limit your intake to one Brazil nut daily, and it is always wise to consult with your doctor if you are on medications for thyroid conditions, blood pressure, or cholesterol, as some nuts can interact with these treatments. Brazil nuts are a potent addition to your diet, but moderation is absolutely essential. Now let's turn our attention to the nuts that should be limited or avoided, as they can present considerable risks for seniors, particularly for those with certain health conditions or who are taking multiple medications. First on this list are peanuts, which, despite their immense popularity, harbor hidden dangers. Unlike true tree nuts, peanuts are legumes that develop underground, which makes them susceptible to contamination by molds that create aflatoxins. These are potent carcinogens that can cause damage to liver cells over time. Seniors who may have compromised liver function or less efficient detoxification systems are particularly vulnerable to these toxins, which can also weaken immune function and elevate long-term health risks. Research from a leading liver health organization emphasizes that even minimal, consistent exposure to aflatoxins can be a concern. Furthermore, peanuts are high in omega-6 fatty acids. While not inherently harmful in moderation, they can encourage inflammation when eaten in excess. Many seniors already consume too much omega-6 from processed foods, and peanuts contribute to this inflammatory load, potentially exacerbating conditions like arthritis, heart disease, or cognitive decline. For these reasons, it is wisest to consider peanuts an occasional treat rather than a daily staple. Cashews are another nut to consume in moderation, mainly because they contain a relatively high amount of carbohydrates. A 1-ounce serving has about 9 grams of carbs, but only 1 gram of fiber, which means they can raise blood sugar levels more rapidly than many other nuts. This is a significant issue for seniors who are managing prediabetes or diabetes, as blood sugar spikes can result in energy slumps and contribute to long-term complications. Cashews also contain oxalates, which are natural substances that can attach to calcium within the digestive system, potentially contributing to the formation of kidney stones. For older adults with diminished kidney function or a past history of urinary stones, cashews could worsen these risks, making them a less than ideal selection. While cashews are not fundamentally unhealthy, their carbohydrate and oxalate content indicates they should be consumed sparingly, especially if you are monitoring your blood sugar or have concerns about kidney health. Macadamia nuts, though they are luxurious and flavorful, are another nut that requires a cautious approach. They are exceptionally calorie dense. Just 10 to 12 nuts contain roughly 200 calories, with most of that coming from fat. In contrast to other nuts, they offer very little protein or fiber to promote feelings of fullness, which can easily lead to overconsumption and subsequent weight gain, a significant concern for seniors managing their heart health or mobility. Macadamia nuts also have a high concentration of saturated fat, nearly 3 to 4 grams per ounce, which can elevate LDL cholesterol levels and aggravate cardiovascular issues, particularly for individuals taking statins or other heart medications. Their rich, fatty composition can also place stress on the gallbladder, a frequent problem for seniors as gallstones become more common with age. Consuming macadamia nuts in large quantities can provoke digestive problems such as nausea, abdominal discomfort, or even gallbladder attacks, so they are best reserved as an infrequent indulgence rather than a dietary staple. Finally, pine nuts present unique risks that make them worth limiting. These small nuts, commonly featured in gourmet cooking, can trigger a strange condition known as pine mouth syndrome, which causes a metallic or bitter taste to develop in your mouth 1 to 3 days after consumption. This unpleasant sensation can persist for days or even weeks, suppressing appetite and potentially causing unintentional weight loss, which is a grave concern for seniors who are already at risk for malnourishment. Even more troubling, pine nuts contain certain compounds that might interfere with common medications, including blood pressure drugs, antidepressants, or cholesterol-lowering treatments. These potential interactions are not widely known, making them a concealed risk for seniors who are on multiple prescriptions. Additionally, the small size and smooth texture of pine nuts make them an aspiration hazard, especially for individuals with swallowing difficulties or dry mouth, which can be side effects of medications. If they are accidentally inhaled, they can obstruct airways or become lodged in the lungs, potentially leading to aspiration pneumonia, a very serious condition in older adults. For all these reasons, pine nuts should be eaten rarely and with great care. To apply this knowledge practically, begin with a simple review of your pantry each week. Make sure to stock almonds, walnuts, pistachios, and just one Brazil nut for each day. Use a small bowl or ramekin for serving nuts to manage your portions effectively. Never eat directly from the container, as it is very easy to consume too much. Store nuts with high fat content, like walnuts and Brazil nuts, in the refrigerator to keep them from going rancid, as rancid fats can transform beneficial compounds into harmful ones. For Brazil nuts, strictly adhere to 1 per day, 2 at the maximum, to prevent selenium toxicity. Research from a major heart health organization indicates that seniors who adhere to structured nutritional plans like this one experience better cardiovascular outcomes, more stable blood sugar, and enhanced cognitive function compared to those who make arbitrary food choices. Consistency is far more important than achieving perfection, so strive to make these smart choices a regular element of your lifestyle. If you are taking medications for blood pressure, diabetes, or thyroid conditions, it is important to speak with your doctor about your nut consumption. Certain nuts can either amplify or hinder the effectiveness of medications, and your healthcare provider can assist you in optimizing both your nutritional intake and your treatment regimen. Beyond just nuts, your entire dietary pattern is your most effective tool for aging healthily. Collaborate with your doctor or a registered dietitian to develop a complete nutrition plan that integrates nuts with other foods that promote bone health, heart function, and cognitive vitality. Routinely check your blood pressure, blood sugar, and cholesterol levels to observe how dietary adjustments are impacting your health markers. Be mindful of your energy levels, sleep quality, and mental clarity, as these are real-time signals of how well your food choices are serving you. The snacks you choose today can either be a foundation for strength in your golden years or a silent factor that undermines decades of health efforts. Nuts are powerful foods that can either support or sabotage your health goals, depending on which ones you select and how you eat them. The difference between flourishing in your later years and facing preventable health challenges often boils down to simple, informed decisions, like which nuts to have in your kitchen. You are now equipped with the knowledge to choose nuts that actively benefit your heart, brain, and overall wellness, while limiting those that carry risks. Share this guide from Health and Food with Dr. William with your adult children, grandchildren, neighbors, or friends who are also looking to make intelligent food choices as they age. Your recommendation could help them steer clear of nutritional pitfalls and forge a stronger, healthier future. Stay informed, stay prepared, and continue to make choices that support the vibrant, independent life you deserve. This information is educational and not a substitute for personalized medical advice from qualified healthcare professionals who understand your unique health needs.